Hi and welcome to another episode here on the OCD Warriors YouTube channel. So tonight you are joining me in my boudoir. I have just come off a 2-hour group support call with OCD Action for people that aren't able to access face-to-face support groups. So this video has been requested by somebody who watched one of my previous videos, and it's to do with medication. So I was talking about in my last video about being on medication and the withdrawal effects and all the rest of it, and how being on medication isn't a weakness. Sometimes it can be 3/4 of the battle into finding OCD remission. You'll have to apologise about the camera shaking. I've got the phone in my hand, and I don't have a particularly steady hand. So the requested video was the pros and cons of medication, the side effects, how they affected me, how they contributed to my recovery. So I was on a medication known as mirtazapine. In America, I think it's called Romaron. It's not a typical anti-anxiety medication. And in fact, medication that's used for anxiety and anxiety disorders such as OCD typically aren't actually anti-anxiety medication. They're actually antidepressants. However, they are very, very effective at helping someone with anxiety as well. These medications are typically SSRIs, such as citalopram and sertraline and escitalopram. Those are generally the most common that are prescribed. I was on what's known as an SNRI, so it was a non-adrenic. Don't ask me what non-adrenic means because I have no clue. But I was on mirtazapine, otherwise known as Romaron. Now, mirtazapine isn't typically used for anxiety. It's more used for severe and clinical depression. The reason I'd been put on the mirtazapine is because I've previously tried sertraline and citalopram. And at that moment when they prescribed mirtazapine for me, they unfortunately, the mental health team that I saw within the hospital didn't really grasp the full understanding of OCD, so unfortunately went for a depression diagnosis rather than actually listening and understanding, which sometimes can be actually more detrimental and actually more damaging sometimes when whoever you are receiving emergency treatment from when you're in crisis can actually make matters worse, particularly if they don't understand OCD fully. So mirtazapine was prescribed. It typically takes a bit longer than your SSRIs to kind of get into your system and for you to start noticing some benefits. So for depression, it can kind of take up to between 6 and 8 weeks. For anxiety, it can take up to 12 weeks before you start noticing a real difference. That's not to say you feel crap and anxious or depressed. For that entire time, you will start to notice the benefits after a few weeks. However, the full effects won't be reached until that 8 or 12 weeks. So mirtazapine is more sedating in its lower doses. So mirtazapine can sometimes be used for people with insomnia because it contains the lowest dose at 15 milligrams contains something called melatonin. So it's sedating. The higher the dosage goes up, the less sedating it is. I know that's really confusing because sometimes it's higher doses and more sedating. It's the opposite way around for mirtazapine. So I know with here in the UK with doctors, they like to increase the dosage quite quickly so that the lower doses, they are in your system, you know what kind of side effects you're going to have, and they're just in your system. So they will then gradually start increasing you to kind of max dose. For mirtazapine in the UK, the maximum dose is 45 milligrams, so it goes from 15 to 30 to 45. They what GPs and psychiatrists like to do is increase them quite quickly, so that you're not waiting around this whole 6 to 12 weeks before you can increase the dose. Unfortunately for me, I had a big barrier to medication before taking the mirtazapine, so I was very, very anxious about side effects. So I kind of took my time before I agreed for the dosage to be increased. Kind of hindsight is a wonderful thing because I regretted doing that. 15 milligrams do knock you out. They do say to take mirtazapine on a night time. 15 milligrams really do get you to sleep. Generally within about 30 minutes of me taking it, I was usually quite, you know, sparked. I also found on the 15 milligrams that I found it really difficult to wake up on a morning fully. So I felt quite groggy for a couple of hours, you know, that kind of half asleep, zombified kind of feeling that you get sometimes, particularly if you feel like you've not slept. You kind of just want to lay on the sofa and kind of nap. That was the feeling that I had with the mirtazapine on the 15 milligrams. When that dosage went up, that started shifting. And then by the time it was on the 45 milligrams, that kind of effect had completely gone. They weren't kind of knocking me out on a night time. With mirtazapine, the pros, actually, they balanced me out really well, enough to be able to respond to CBT treatment and ERP, and I think that's really, really important. I know you can see the screen lighting up at the moment, it's just I've got notifications coming up on my phone. So yeah, sometimes when we are really, really triggered and we are going through a really difficult cycle with OCD, sometimes it's better, more beneficial to kind of get that under control first before we look to doing therapy. Sometimes medication can really just help reduce the effects of the anxiety and the OCD that we're experiencing so that we can respond fully to the therapy and the treatment. It was a really important question that I wanted to kind of cover today that I got inboxed earlier about medication, which tends to come up quite a lot, and I do get asked quite a lot, is what medication stops intrusive thoughts, what medication gets rid of OCD. Unfortunately, it was covered in another video previously, so if you do go down my channel, you will find it. Medication doesn't stop intrusive thoughts. So intrusive thoughts are going to happen, period. Everybody gets intrusive thoughts, OCD or not. What medication does is it balances you out enough. It helps with those serotonin levels, and it will reduce the anxiety effects that you're feeling from those intrusive thoughts. So it may slow down the racing thoughts that we feel. It will certainly reduce the effects of those adrenaline rushes when we're going into fight or flight. And just kind of stabilize that a little bit so that we can better respond or better manage the intrusive thoughts. But typically there is no medication out there that will stop intrusive thoughts. They are going to happen anyway. The treatment for OCD and intrusive thoughts is to accept that those thoughts are there, accept that your brain, everybody's brain throws them up at some point. But it's about changing our relationship and changing our response to those thoughts. That's what makes the difference. So like I say, the pros to the mirtazapine and any other medication really that you are looking at taking for your anxiety or your OCD can really be half the battle with finding remission with OCD. Some people are very anti-medication. There are kind of holistic ways you can go to help reduce the effects of the anxiety, but please, if you are watching this and you are trying to find a cure or a fix to get rid of the OCD thoughts, it's going to be a battle you're not going to be able to win. And I don't say that in a negative way or to be hurtful. I say it because there is no medication, there is no supplement, there is no natural remedy that is going to switch off those thoughts. The only thing that is going to be beneficial for you in overcoming it is changing your relationship with those thoughts. Let them in, let them be there. Disobey what it's telling you to do. So disobey the compulsions, don't do them. And I know that's easier said than done, but with the right treatment and the right therapy and the right approach, you will get there where you can decide whether you want to engage in a compulsion or not. You have that power then to decide how you respond to those thoughts, and it, you know, that choice is in your hands. So you're taking your power back from these bullshit thoughts, basically. So like I say, those of you that are kind of anti-medication, there are natural kind of things that you can take that can reduce your anxiety. There's chamomile tea, there's a good diet, there's cutting out caffeine, you know, all these things that can be that can increase anxiety. You can have a diet where you're eating foods that naturally produce or aid the production of serotonin. The gut-brain link, so 80% of serotonin, so the neurotransmitters in your brain, so antidepressants and SSRIs, which are the medications, help to balance out serotonin and increase those neurotransmitters in your brain. Serotonin is one of those neurotransmitters. 80% of it's actually created in your gut before it's sent up to your brain. So you could even research into what foods are good for your tummy. Anything with amino acids in there are really good for creating those neurotransmitters and increasing them. So if that's the way you wanted to go and you didn't want to go on medication, then that is definitely an option. Medication isn't right for everybody, and it can be trial and error. Not every, you know, I was really lucky with the mirtazapine that it was the first kind of medication that I tried, and it was the first one that worked. I have been put on sertraline and citalopram before, however I only took a couple of doses because the side effects didn't agree with me, so I didn't take any more. So technically the sertraline and the citalopram didn't really have a chance to work. They do say a minimum of 2 weeks before you start feeling kind of any effect or any benefit from them. I think I took about 3 days on each of them, and they just didn't agree with me. That's not to say they won't agree with you. Everybody responds to medications completely different. For myself, I have emetophobia, which means I have a fear of sickness and nausea. So any medication that makes me feel either of those, I will not take them at all, and it's pretty much a no deal. So mirtazapine was the one that didn't kind of have those side effects attributed to it. However, with mirtazapine, the con of taking those was the weight gain. Some medications can cause weight gain. It just depends on your particular body, genetics, you know, and all of those kind of things. It all depends, you know, those side effects are there, they are listed. That's not to say you would get them. Everybody responds completely different. Mirtazapine, however, is notorious for weight gain, and it is actually a well-known drug that is used for persons with eating disorders such as anorexia, because it's an appetite stimulant. So mirtazapine really does make you quite hungry all of the time, or makes you feel like you need to be eating all the time, hungry or not. So for somebody that engages in intermittent fasting, that's kind of another video for another time. I don't do breakfast. I generally don't do lunch. I kind of snack little and often throughout the day, and then have a meal at tea time, and then some snacks like kind of after tea or dinner. When I was on the mirtazapine, I found I needed to be eating all the time. I was in the cupboards all of the time. So I actually put on, I think, around 25 kilos in the 12 months that I was on the mirtazapine. However, since I've been off them, I'm actually finding I'm losing that weight pretty quickly, because my metabolism is returning to what it was previously. So, you know, yes, the weight gain was a bit of a deal breaker for me, and I wasn't happy with how much weight I was putting on. However, it was agreed for me to come off them completely. If you are thinking about going on mirtazapine, it is a very, very helpful medication with barely any side effects, to be honest. The only main one being the weight gain. However, the way I see it is our mental health is much more important than weight gain. Yes, it can affect our self-esteem, it can affect our confidence, and we can be really unhappy with the weight gain. However, you know, medication don't have to be lifelong, particularly when it comes to like anxiety and depression. You know, so long as you have the coping tools and you've had the therapy or you've got the support in place to manage your diagnosis, there's no reason why, you know, you can't consider not being on them. I would always say seek advice from your healthcare professional before you decide whether you want to come off them or not. But for me, it was a small price to pay. I knew I wasn't going to be on the medication permanently, so I kind of grinned and bared the weight gain, because after I come off them, I could get into the gym, I could eat healthily, and do something about the weight. So it's not something that has to be permanent. So that's kind of my experience on mirtazapine. The other ones I can't really comment because I haven't been on them, so I can't really advise on that. However, what I will say is medication is trial and error. So it might take for you to try a few different ones until you find one that works well for you. There are sometimes people need a combination of 2 different ones. So if you're getting side effects from one, then you maybe put on another to counteract that. Or, you know, sometimes it takes a combination of different ones to be really helpful for you. But I definitely don't see medication or being on medication a bad thing. It doesn't mean that you would then be treatment resistant. I know there is some programs out there or some cures, as they say. I won't mention it, but there is one that's actually quite well known. That costs around £200 and promises for you to be anxiety and OCD free. That suggests that medication prevents you from getting any better. That is not something I agree with. It's also been suggested by certain persons that medication is a crafty way for pharmaceutical companies to keep you stuck. So basically you are put on these drugs to keep lining the pocket of pharmaceutical companies, which doesn't make sense. I definitely don't believe that. Mirtazapine was a godsend for me. And it really helped me to get back on an even keel so that I could respond to treatment. It certainly didn't stop me from feeling full benefits of CBT and ERP, and my OCD is generally remission each day. I do get a couple of lapses sometimes, but that is to be expected with anything, not just OCD. We can expect stress in life because life can be pretty crap. It's not all sunshine and rainbows every day, like I was explaining the other night. OCD, we are always going to experience days where it kind of flares up, when we're under stress, when we're tired, when we don't feel well. You know, it's just a case of having in place some coping tools and self-care and managing those crap days so that you can enjoy the better days. But, you know, like I say, medication isn't for everybody, but at least give it a try. You know, you've got nothing to lose by trying it. If it doesn't agree or you don't like being on it, then, you know, that's absolutely fine. Oh, excuse me, I'm very sorry. But I'm also not against people who just will not take medication, who feel there is a much more natural way to go about it. Everybody has what's right for them, and you know, it's up to you. It's your body, it's your diagnosis, it's your mind health, you know, so you do what's best for you. But I thought I would come on. I did say I was going to do this really quickly, and it's a 20-minute video. But I hope this is helpful for the lady that asked me to do it. And I hope it's helpful for you, the viewer, as well. As always, any questions, drop them down into the comments. Or if you have anything that you would like me to talk about on another video, again, drop your suggestions down below. I do have a Facebook page called OCD Warrior. So it's just this without the hashtag OCD Warrior. That's on Facebook. You can reach out to me there as well. For those of you that are in the UK that feel they would benefit from being part of the support calls, I facilitate every second Thursday and fourth Thursday of a month, so this being the second Thursday of March, and then I run the fourth Thursday of the month as well. They generally start at 7 PM and they run for 2 hours, and they are great. You can either just sit and listen in to everybody else, or you can join in the discussion. You can talk about, you know, how OCD is affecting you, your story with OCD, pretty much anything you want to talk about on those calls. They are free, so all you have to do is go onto the OCD Action UK website, register for the support groups, and you let them know which group it is you want to be added to. And you'll be added, you'll be put on the call list. Obviously you have to give them a phone number. You can either join in on the phone or you can join in through Skype. Absolutely up to you. You literally just, your phone number gets added to a list, and then at 7 PM on that whichever day you've joined, your phone will ring. You just pick it up like a normal phone call, and I will be on there. So that's for those of you in the UK that want to access that. There is that option. So it is OCD Action. If you just pop that into a search engine, it will come up, and there'll be an option there to register as well. There are other support groups that they run. They do a body dysmorphic support group. They do a support group for parents who have children with OCD. They have, I can't pronounce the full name, but its shortened name is Trick, so that's the hair pulling. And the other one is it's Trick and Derm, so skin picking. So if you have either of those, they are subsets of OCD, as is body dysmorphic disorder. So if you do have, if you are watching and you do have those subtypes of OCD, then there is a support call group on through OCD Action as well. If you find that would be really useful for you or beneficial, and you'd like to join, just go onto the website again, join up, leave your number, and somebody will be in contact with you for that. So I'm going to jump off, and I hope this has been helpful for you. Like I say, drop any comments or suggestions for any videos in the comments, and I'll get them uploaded. Probably won't be tonight, but over the next couple of days. So take care.